Vietnam veterans, hailed as America's heroes, faced immense challenges upon returning home. Beyond physical wounds, many veterans carry hidden scars impacting their long-term health. These invisible wounds stem from exposure to hazardous substances and combat trauma. As a medical professional, I've seen the debilitating effects on their lives and families. We'll shed light on common health problems, exploring causes, symptoms, and support available. Understanding these issues is key to ensuring our veterans receive the care they deserve. Imagine living with constant fear and anxiety long after the battle is over. For many Vietnam veterans, the war continues in their minds, replaying traumatic experiences. PTSD is a serious mental health condition triggered by terrifying events like combat. Symptoms include intrusive memories, emotional numbness, difficulty sleeping, and hypervigilance. During the Vietnam War, the US military sprayed millions of gallons of herbicides, including Agent Orange. Agent Orange contains dioxin, a carcinogen linked to cancers like prostate, lung, and non-Hodgkin lymphoma. It's also associated with type 2 diabetes, heart disease, and Parkinson's disease, plus birth defects in veterans' children. The physical demands of combat, coupled with the unforgiving terrain, took a toll on many soldiers. Today, many Vietnam veterans grapple with chronic pain, a persistent reminder of their service. Back pain, joint pain, and arthritis are common complaints. The connection between mind and body is undeniable, and for Vietnam veterans, PTSD can manifest in physical health problems, including cardiovascular disease. Studies show a correlation between PTSD and heart conditions. Vietnam veterans were exposed to airborne toxins like Agent Orange, smoke, and dust. These exposures are linked to respiratory disorders like COPD, emphysema, and lung cancer. These conditions make breathing difficult, limit activity, and impact overall health. While PTSD is a significant concern for Vietnam veterans, it's essential to recognize that mental health is multifaceted, and many veterans experience challenges beyond PTSD. Depression, anxiety, and survivor's guilt are common. These conditions manifest in sadness, hopelessness, irritability, social withdrawal, and difficulty concentrating. Returning home from war can be a challenging transition. And for some Vietnam veterans, coping with PTSD and trauma can lead to substance abuse. Alcohol and drugs may seem like a way to numb the pain or escape memories. However, substance abuse can have devastating consequences, leading to addiction and health problems. The battlefield is a cacophony of sound: gunfire, explosions, and roaring aircraft engines. Many Vietnam veterans experience hearing loss and tinnitus, a constant ringing in the ears. Hearing loss makes communication difficult, leading to social isolation and frustration. The long shadow of Agent Orange continues to impact Vietnam veterans' health, with an increased risk of developing type 2 diabetes. This condition requires ongoing management to prevent serious complications. Gastrointestinal disorders are common among Vietnam veterans. Irritable bowel syndrome with abdominal pain, cramping, bloating, and bowel changes is frequently reported. GERD, ulcers, and chronic constipation are also common. As we've explored in this video, Vietnam veterans face unique health challenges, many linked to their service. These brave men and women sacrifice so much for our freedom and deserve our unwavering support. Addressing these concerns isn't just about medical treatment. It's about honoring their sacrifices and ensuring they have access to the care they deserve. From mental health services to financial assistance, organizations help Vietnam veterans live healthier lives. If you or a loved one is struggling, please reach out, seek help, and let us stand by your side, just as you stood by ours. You fought for the country. Now let us fight for you. TheBestNexusLetters.com